Well, today again here with Dr. Shluper, dentist in Bloomfield, New Jersey. Hi, Dr. Shluper. How are you?
Hello, Helmut. Nice to see you.
Very good. Dr. Shluper, tell us, you have a dental practice, and many dentists, like every person, we have different philosophies. What can a patient who comes to your practice expect as a philosophy of your practice? What is your driving, underlying principles with which you see patients, treat patients? Are you treating young patients, old patients? Is it only cosmetic? Is it, just go ahead and tell us a little bit.
Yes, my primary goal is to save the existing teeth of the patient. I always believe that the best teeth that are your natural teeth. There is nothing that is better than your own natural tissue. And the way they are in the mouth, they naturally built to prevent any accumulation of food and to prevent decay. If you start to place all artificial appliances, artificial fillings and crowns, you just increase the chances of the teeth to deteriorate. Crowns and bridges, as good as they are not natural tissue. And they cause drop.
I see. So that's your last. So basically, to put artificial stuff into the patient's mouth, whether it's an implant with a one of those metal screws, or whether it's just a crown or a bridge, or for that much, ideally even a filling, you try to avoid that and try to do preventive. Basically, an ounce of prevention is worth a pound of cure, something in that neighborhood. Is that what you're trying to tell us?
Exactly. There is nothing better than your own natural tissue.
Sure. Now, that said, I'm sure lots of people come to you who need crowns, bridges, implants, dentures. Are you doing those type of work in your office?
Yes, we do. We do all necessary work that are required to restore the mouth to its best and ideal position. We do the crowns, the bridges, the implants, everything to restore the patient to his ideal position.
Beautiful. Are you seeing children in your practice, Dr. Shluper?
Yes, we do see children. Preventive measures should start as soon as we have teeth in the mouth.
Mm-hmm. Good. And what about when especially actually it's elder adults also, or adults, but in many cases teenagers. What about orthodontic work or invisalign? Are you doing that type of work?
Yes, we do invisalign, we do orthodontic appliances.
Beautiful.
We would like to straighten the teeth without much of reducing the natural dentition of the patient. Just to straighten it as much as possible.
All right. So, for instance, probably in your philosophy, while a veneer and a lumineer is probably a very good thing sometimes and very beautiful and all kinds of things, if possible, you would try to do it without it by maybe straightening out the teeth. And, of course, sometimes a tooth needs a veneer and a lumineer because it's so badly damaged, and in order to make it look good and functional, you need to do it. But so you like orthodontic work and Invisalign because it gets things. You don't need to take out the teeth, and you don't need to replace them with artificial stuff, as you said, right?
Exactly.
Good. What about dentures? Are you doing dentures for the elder patients?
Yes, we do dentures. I especially like the dentures that look natural. I do not like those dentures that show the metal clasps or hooks, as the patient called them. Most of my dentures, you do not see that there are dentures in the mouth.
Beautiful. Beautiful. What about periodontal gum disease? Are you fixing those type of things also?
Yes, we treat the gums of the patient. We have a very good hygienist at the office. People come out of the cleaning like they feel like a new person.
Well, it makes lots of sense, of course, that, you do gum surgery and things like that, because many times that's the only way to prevent that the person is losing his teeth, which to you really is just not a good thing. Even though you may make more money replacing his teeth, you rather save him. And quite often, good cleanings, good hygiene work, and if needed, gum disease treatment are the only way to do that, right? Well, Dr. Shluper, super interesting. Tell me something, Dr. Shluper. What made you become a dentist?
Sorry, would you repeat the question, please?
What made you become a dentist, Dr. Shluper? What drove you to this type of profession?
Well, I like very delicate work. I feel satisfaction when I work with the bad situation and to make it ideal situation. And I'm into a small area of the work. The mouth, I got to love to work in the mouth. It is a small area, and actually I see it a very big area. I do work with microscope. And when I look at the tooth through the microscope, I see it as if it were a movie theater.
Beautiful. So basically, it looks like you probably don't miss much. It is quite amazing how many areas the mouth affects. Most of us have no clue. Like, if you lose teeth and because of it you will lose your gums, you get a caved-in mouth and you start looking 20, 30 years older. You look like a dried-out tomato. People who have a misaligned jaw, they can get headaches. And back pain and neck pains. Gum disease, people can get liver disease, kidney disease. Really, I think when you say the mouth is a very small part of the body, but boy, is it interacting with the rest of the body, you're right. So I think patients should be very happy that you look into it with a microscope and just fix it. Wonderful. Well, Dr. Shluper, thank you very much for telling us all about your practice. I appreciate that, and we're going to talk more about some specific areas. Bye-bye.
Okay, thank you.